Director of Sullivan County Regional Health Department. He has worked many long hours in the past few months, and he is here to give the board as well as our citizens an update related to the latest on COVID. Also with him is Dr. May.
Dr. May, the medical director of the department. Welcome back, Gary.
Welcome back. Thank you. It's nice to hear welcome back, and it's always an honor to appear before the council and the board and mayor and speak with you and the citizens of Kingsport. Dr. May and I are very glad to be here tonight, and gives us a little break, shall I say, from the day. But we thought we'd just go over our current disease state in regard to Sullivan County, and mostly take time for questions that the council, or that the alderman may have. Get my cities mixed up, and so we'll be glad to do that. But I would like to preface by saying I think it would be appropriate for us to recognize those that are working long hours in regard to this response, and I would be amiss not to mention the Sullivan County Regional Health Department and all the employees that work there. Been working 7 days a week around the clock, and including Saturdays and Sundays, late hours. Serving our citizens and doing a wonderful job, I might add. We're doing everything we can to augment that capacity at the health department as quickly as possible. And also like to recognize our public safety personnel, our police and our fire and our EMS, our sheriff's department, that are literally out there every day working with folks that are sick and helping them and rendering medical care. And of course, we can never forget our doctors and our physicians in Sullivan County and the Tri-Cities, doing a remarkable job, I might add. And so we're very grateful for competent, dedicated, and a great community, as you alluded to earlier, Mayor Scholl. So I'll kick it over to Dr. May, and he can go over some numbers with you, and then we'll take questions, if that's okay.
I want to thank you all for having me and the support that you provide for our health department to allow us to serve your citizens in such a fashion. When we look at what's happening across the state, we've seen about 847 deaths out of 79,000 cases now across the state of Tennessee. We're looking at 10% of hospitalizations now are related to COVID across the state of Tennessee. We do know, working with our ballot facilities, out of 100 COVID beds that's been dedicated, 70 of those remain filled right now, and they're really having a challenge finding floor beds and ICU beds. Ventilators, I think we're doing pretty well. In Sullivan County, our R0, which is just a measure of how many people do we infect with one person, is 1.3, which means that our case numbers are going up. Over the last 4 weeks, our case counts have doubled every week. This time last week, we were at 200 cases. Today, we're at 444, and it's still counting as we go up. Fortunately, our death rate for Sullivan County is only about 1.3%. We've had 6 deaths so far. We have 26 plus in the hospital, 16 in the intensive care unit, 5 on ventilators. So we're starting to feel the full effects of the disease within our community. With that, we are working on getting the masking order out. And Mayor, I thank you so much for your support in helping getting this masking message out. We do know mask works. Masks prevent disease. We have to remember the mask protects your neighbor. Your neighbor's mask protect you. So it's important that we all treat each other as if we're potentially infected. Also, maintaining this level of distancing, which you're doing an excellent job with tonight, is also critically important to prevent spread of the disease. Recognize that it takes about 1 to 2 incubation periods to see the changes that we put into place. So hopefully in the next couple of weeks, as we've got the mandatory mask order and distancing out, hopefully we'll see this level off. Currently, when we look at our nursing home bed status as far as the ability to visit, we are well above the visitation limit, so all nursing homes are closed to all visitors at the present time until we can get our numbers down below 10 per 100,000 average over the previous 14 days. We're also working extensively with the schools. We do have come out with a plan as far as guidance for how schools could potentially reopen. It was graded in a red, yellow, green light fashion, and currently we would be opening up in a red condition, so that would be the most limiting situation. So looking at extensive online learning, maintaining distancing, and smaller classroom sizes. And so with that, I'll conclude my report and be glad to take any type of questions.
Thank you. Let me start around with my colleagues. Ms. Betsy, is there anything you'd like to ask?
That they're going to still be in the red on August the 3rd, or I know that a lot of the systems have pushed the date back to the 10th for that reason. So I don't know if Kingsport, if you're predicting that we'll still stay in red or.
At our current rate, excuse me, I'm sorry. At our current rate of rising cases, I fully anticipate we'll be opening in the red. I really don't see how we can get our case numbers down in that short a period of time to get us back into the yellow zone.
Okay, let me interject since Alderman Cooper brought that up. This is for our citizens. Remember, the school board members are elected by you all, our citizens, just like you elect the board of mayor and aldermen. And there's a distinct difference in the duties of the two bodies. So this call on how to operate the schools in a safe manner, that's in their ballpark. That's their call to make. We can be supportive and so forth, but they're, like I said, they're elected in their own right. But as you might have inferred from Dr. May and Mr. Mays, is that they have consulted extensively with the health department on guidance on how to set the levels, what those mean, red, yellow, green, and how to apply the current situation to education process. So, thank you. Betsy, are you good? Okay, Jennifer?
I think like a lot of parents have spent a lot of time on the Epi curve page this Tennessee has with county numbers. I just want to talk about why this number 10 cases per 100,000. Is that a number that we really care about? And I noticed that on the website for Tennessee, I think it says, you're over the limit if you're above 10. So can you talk a little bit about why 10 and under is sort of where we want to be?
All right, the magic number of 10 was the number that was selected by the Tennessee Department of Health statewide, and it was actually looking at what is a safe level of community spread that we can afford to allow the opportunity for visitation within the nursing home setting. Of course, they are our most vulnerable and sensitive patients. So that number was selected based on a number of recommendations, both from CDC, looking at the other parts of the country, and that was how that number was selected. Now, this number was actually never intended to be used for schools, and a large portion of the state is not using that. However, to provide guidance for our school systems to give an idea about safe entry into schools, we had to have a level, and that was a known level. It's widely published, it's uniform across the entire state, and available for everyone to look at. Now, we may be providing some a modified number that will remove the clusters that are not truly related to community spread. So it will be somewhat different, but basically based upon that number to give us an idea of how to operate the schools for the ongoing week. This will be a weekly number that we provide with a separate indicator that will be available on both our website, and it will also be available for the school systems to share. We'll meet together with the school systems every Thursday, look at our numbers, look at the overarching situation, and what are the comorbidities, confounding factors that may influence that number. We'll make a decision on Friday. The school system, rather, will make the decision on Friday to determine how they're going to operate for the next week. This will be a weekly based decision. Of course, that can be altered or changed depending on the individual situation, looking at individual classrooms with outbreaks, schools with outbreaks, that may modify some of those operational parameters.
And if I could just ask a follow-up question, I'm just curious about, are you seeing any trends in how people are acquiring COVID in the community? Is it workplace exposure, small groups, social groups? Any emerging trends that you think is good for citizens to sort of think about and be aware of?
Well, the major driving factors in our number now are two. One is travel, that we're actually paying the price for from 2 weeks ago. A large number is related to travel. And the second is now community spread. We're actually seeing it being spread within different regions within the community. We do have 5 or 6 clusters in our nursing home healthcare facilities, but they are not the major driver of the disease that we are currently seeing in our community.
Thank you. Thank you for all you're doing as well.
Thank you. Alderman Phillips?
I just have a couple questions based on the numbers. So we've had 444 cases as of today. That's since the beginning, right? Do you know how many are active right now?
Our active case count is around 200. It changes daily, and I don't have that specific number, but we're looking at about 200 active cases at the present time.
Okay. And I know a couple people that have had some tests, and they're running about 7 days behind. So when you see a number in today's paper, in Tuesday's paper, that may actually be a reflection of who all got tested last Tuesday. Would that be a correct statement?
That is correct, and you have to look at which individual lab they were tested at. We have some labs that are turning around in 48 hours. Some labs are taking 7 to 10 days.
Okay. That's all I have.
Thank you. Alderman Oldham? Okay. Darrell?
Well, appreciate you guys being back to see us again. Over the last couple of days, I've had emails, calls, texts, concerning the school system. So I think there's a lot of concerns right now, around that. So I know other school systems has delayed at least by a week or two. So in your opinion, do you think that would be a possibility of maybe delaying Sullivan County or Kingsport City by a couple of weeks and see if the numbers would go down, because we're working in the 14-day period past, and we're seeing a pretty high spike right now.
Yeah, and that's a fair question for sure. So the decision to open schools or close schools is, as Mayor Scholl alluded to, we are working with the schools very closely, but it is ultimately a school administration and school board decision when they open, or if they open or delay a date. And just to amplify what Dr. May was speaking of on the number, as previously alluded to, the website is getting a lot of hits and a lot of interest because the school plans are centered around that, and people really like to embellish a binary number up or down, or understand trigger points. I think is a very common. But the concept that Dr. May spoke of is in concept. It's a discussion, hasn't been fleshed out with the school boards yet and or school administration. We think it is a nuance that could help improve communication, but it is a concept that we're working on with the school districts, Bristol, Kingsport, and Sullivan County. And I would like to add, if I may, that the superintendent and administrations of all three school systems, and including St. Dominic's and Tri-Cities Christian Academy, are wonderful to work with. We meet very frequently. We spend a lot of time with the school systems as a health department, and really working together, much like the mayors in Sullivan County and Kingsport and Bluff City are doing. So we think that's a strength in our region in terms of our response. So schools are working well together, and I think if there is anyone in the state of Tennessee that can open up schools safely for the staff and the students, I think it'll be the school systems in Sullivan County.
Well, no, I appreciate it, and I agree. I think that, we all know Dr. Morehouse, his staff, and the Board of Education, and I know that they are working hard to do what's best for our students and their safety and welfare. There's no doubt about that. So we appreciate their hard work, and yours too.
Anything else?
No, I'm good.
Vice Mayor?
Obviously, we're very concerned about the kids in schools. Of the 444 cases that have been in Sullivan County, what percentage have been children under the age of, say, 12 or 13? I mean, what are we seeing in terms of this affecting our children?
There have only been about 6 to 8%, looking at less than 10. We do have a detailed breakdown on that. That's as close as I can quote it at this moment.
Have the children that have gotten it, any of those been hospitalized? I mean, is it affecting them? I know we're very concerned for the elderly, and it seems that this hits them so much harder. What are you looking at in terms of if someone's child does get it, is in one of the 6% of the cases that gets it, what are we looking at for severe? I know every case is different, but are they handling it better for the younger people?
Well, at the present time, none of our children have had to be hospitalized except for one, and they have recovered and done quite well. There is a rarer syndrome that is quite serious called multi-inflammatory syndrome of children. Looks similar to a Kawasaki's disease, which physicians are very familiar with and very common. That it has the potential, but the incidence is extremely low. In Virginia, they've only had about 6 cases. One of those did die, but it's not very common at all. Most children do well and basically remain asymptomatic, but they remain great spreaders of disease. And the real challenge is the children bringing it home either to a vulnerable parent or to a grandparent, and we know grandparents have a lot of child rearing responsibilities in our community, and those are the ones that can develop the serious illness that we're really concerned about.
Thank you. On my next question, a lot of the people that have tested positive have been quarantined. What is the rule now? I mean, I've heard some different things, and of course I think different states are doing it even differently, that if you've had a fever and you don't have a fever for 2 days, and you're fine and you can go back to work. I mean, when is it, if you are self-quarantined, you've had a positive test, at what point are you considered recovered if you're self-quarantined?
All right, that question I can handle. And there was a change that came out with that today from the CDC and adopted by the Tennessee Department of Health. So when we're talking about a sick individual or a person who is positive and has the disease, we talk about the concept of isolation. With isolation, you must remain isolated 10 days from the onset of your symptoms. A minimum of 10 days is isolation. And now, we used to say 3 days feeling well. we've dropped that down to 24 hours of feeling well and without a fever. So I used to talk about the 10-3 rule. Well, now it's going to be the 10-1 rule. So a minimum of 10 days with at least the last day feeling well and without fever. Now, the other concept we talk about is quarantine. Now, quarantine is for those who have had contact with a known case, and quarantine patients need to stay in quarantine for 14 days. And that is regardless of whether they get a test that tests negative within that 14 days, because we really don't know when they're going to go positive. They may be negative today but turn positive tomorrow. So the quarantine time, which is basically an incubation time, we want to be sure that they don't get sick for that entire 14 days. So quarantine is for well patients who were worried that may become ill. Isolation is for those who are positive, and we need to isolate them and keep them from giving it to anyone else.
Okay, so if I test positive today, but I feel great, then I would be isolated for 10 days, and then it's
A minimum of 10 days.
If I felt great the whole time, then one more day, and I could go back to work.
You can go home after the full 10 days.
But if I sit by Ryan and he gets it, then I've got to quarantine myself for 14 days, even if I'm fine the entire time. Because I came in contact with him.
That is correct.
Okay. On the other last question, just in terms of testing, are you seeing that are a lot of people taking advantage right now of the testing sites, or have the testings gone down more just into a need base? If people have symptoms or they feel like they've done something, they're testing, but or where are you on testing numbers?
Well, we're actually seeing an increase in the number of people with symptoms, and we're seeing up to 10% of those that are testing positive, which means they do have the illness.
Okay.
We like to do enough testing to get our test positive rate down to 5%. That tells us that we're testing enough negatives that we're getting an idea that we're not missing cases. When it gets a bunch above 5%, then there's a probability that we're missing more cases that we don't even know about. So that's why it's so important we try to increase our testing. Now, we've had a lot more interest in the last 2 weeks, both because people have had symptoms and they've had contact with known cases. And as such, we are testing at a quite high rate. We're still not testing enough, though, based upon our positivity rate. Did I get that right, Gary?
You're 100%.
Okay, let me see if I wrote down any other questions I had. And you talked about we had a few clusters going on right now, but it's more community than clusters, because I looked at the numbers in terms of, I know, a couple there's a couple of clusters that we've kind of read about in the paper, but.
Right now we have 6 nursing facilities with clusters that we're working and keeping an eye on, and we have 5 other clusters within community businesses, I guess is the way to put it, business institutions or other agencies outside the healthcare world.
That's all my questions. Thank you.
Thank you. Well, I guess I want to drive home that quarantine point, because, and I'm going to put out a fictional example, but tell me if I've got it right. If a person, say, who works in a small business comes up positive on the test, not only would they quarantine, but their family would quarantine, and their coworkers in the small business would quarantine.
I think what you're getting at is looking at what is the definition of a contact who would need to be placed into quarantine. And our contact tracing team actually does a very detailed history when they interview the actual case. The definition of a contact is a person who is within 6 feet for greater than 10 minutes without any type of protection. And based upon that, we place those contacts into quarantine. Now, we don't necessarily quarantine contacts of contacts.
I got you. Which means, depending on the situation in that small business, some coworkers may or may not have to quarantine.
That is correct.
Which really drives home the idea of why we're washing our hands, why we're using hand sanitizer, why we're wearing masks, why we're keeping a distance.
That is correct.
Not because we don't like each other, but because we do like each other.
These are the control measures that really makes a difference in defining whether you become a contact or not.
My last question is I know you all put a lot of resources in the contact tracing. What is it telling you so far?
Well, when we look at it, we're seeing, first of all, we talked about the clusters. We've talked about community spread, so those are just people in the community who become ill. And we've talked about a lot of cases tied back to travel. People who went on vacation, went to a hotspot area, didn't really use any type of protective actions, and have come back infected. Those are our major drivers of the disease at this point in time. And we still don't know what is going to be the effect of school children coming back together. That is an unknown.
So if a Kingsporter wants a test, what's their avenue right now?
Right now you can call our health department at 279-2777. You'll actually be answered by a human being who will first of all listen and see if you have any questions. And they'll determine first of all, are you having symptoms? If you're having symptoms, we have one lab mechanism. If you're asymptomatic, we try to get you either on Tuesdays through our drive-through clinic, which we extended this week. We have 2 sessions, both morning and evening. I think today we tested over 100 people. On Thursdays, we actually try to have other testing that's asymptomatic through another local lab. On Wednesday mornings, we try to get people tested that want to visit the nursing home. But right now, that's actually going to drop down for us because our nursing homes have just gone closed. But we do have an avenue to test those who want to visit within the nursing home setting. Gary, I'll let you expand out on any more of that.
That was great, Dr. May, and thank you for the question. But we encourage anyone that wants a test to call 279-2777, and if you've been symptomatic, think you've been exposed, or you just want to be tested, to call that number, and we will get you tested. So our staff is doing a very good job at that, and it's a big priority for us. So before we wrap up, Mayor, I just would like to emphasize the message here tonight, and our most important message is that we are seeing an increase in cases. It was anticipated all around Sullivan County and Kingsport. You could see cases rising. I think the citizens of Sullivan County and Kingsport and Bristol and Bluff City have done a great job. And we just ask that they continue to be supportive of the safety measures, support the safety measures for the children in our school system, and work with us as much as possible and minimize the disease, and also minimize the economic impact that we could potentially face coming down the road. And I want to say, not to embarrass him, but I really want to thank Dr. May. He's a unique individual. And since February, he's been putting in long hours, does a lot of consults every day, makes a lot of decisions every day. He has a lot of responsibility on him. And I've been working with him for years, and of course we're close friends, but I just saw a new trait, a skill that he had that I didn't realize. You know, if you look at him, he only has 2 ears, but I can see he keeps 3 phones going in a Zoom at the same time, and is able to coordinate all those conversations, and I'm impressed. So very grateful for Dr. May and the job he does and the service he provides for our community. So thank you again for inviting us.
Gary,
it's always an honor.
Thank you for coming, and we really appreciate your professionalism, your diligence, and your dedication to what you're doing, and you're going to help us get through this. We appreciate it.
Thank you.
Thank you.
Yes.
Just one more thing, kind of backing up about contact.
Oh.
You were saying if they were within 6 feet or 10 minutes or greater without any protective, but they would, if I have a mask on and the person that had symptoms or is also had a mask, then I wouldn't have to quarantine. Is that what the mask does? I know the 6 feet and 10-minute rule, but clarify the rest of the statement.
Basically, if we have both parties in a mask and they maintain 6-foot distancing, they're not considered a contact. That's our definition, is being sure that you have that mask on to protect you from each other. Now, that does not mean that we would not continue to monitor you and ask you to monitor your temperature and your symptoms on a daily basis.
Okay, well, thank